Good morning. I wish to start by saying our campaign does recognise the enormous challenges the government's strategy to expand the BLMK ICB into Central East presents for infrastructure planning, and the personal pressures this has put onto NHS staff who have either faced redundancy or now have a greater burden of responsibility. However, I have to take this opportunity to remind representatives here today of the concerns we have raised in our last communication with the ICB on the 30th of January concerning the Leighton Buzzard Clinic and the 10-year plan for our town. You have made statements in the media at the opening of the clinic with Robin Porter and Wes Streeting present, and in your annual report implying that there will be 56,000 extra appointments per annum. And this now feels disingenuous that the number was closer to 10,000 for the first 6 months. This has lost the community's trust. Now we are hearing caveats around appointments like capacity or offered or available, and that improvements are still dependent on future staff recruitment. Frankly, this should have been stated up front to avoid confusion as to why the numbers appeared so low, and shouldn't have required time-consuming scrutiny from us that included sitting outside the clinic counting visitors for a week to get to the bottom of this appointment anomaly. I would ask the chair of this committee to help facilitate our earlier request for a face-to-face meeting with representatives of the ICB to clarify what was the appointments capacity before the seven new rooms were opened, how many more appointments the rooms added, and what kind of treatment, as we are keen to obtain clarity in particular on what is being termed recently by the ICB as an urgent care service. In addition, at January's Health and Wellbeing meeting, a councillor from Appt stated, and I quote, "Really pleased to see the continued realistic focus on the reuse and repurposing and maximising the use of existing NHS estate that we have. When we first came into this, we had a lot of noise about the shiny new health hubs that we all wanted. That these little improvements don't seem much in comparison to some, but I think that they have bedded in, and I think that they're really useful and valued." Chair, could I ask you to raise a question with Councillor Zerny as to why Central Bedfordshire Council appears to have so little ambition to challenge the ICB on its infrastructure strategy for this region? We had the largest population in the BLMK ICB, but have seen the least investment in the past 15 years and see minimal investment here in the next 10-year plan. Why shouldn't we expect new health or diagnostic centres? Even the planned investment that Wixons have waited 16 years for, according to their MP Blake Stevenson, was obtained through Bedfordshire Borough Council, who have allocated £5 million from its capital budget for this project. And in his speech in Parliament in March, he stated that the government expect neighbourhoods to have a geography of around 50,000 people. And I'm afraid that we will do nothing for people in mid-Bedfordshire. It will mean either that rural communities on the edge of urban catchments will be split up and served by neighbourhood health hubs in nearby major settlements, which will likely be Hitchin, Bedford, Luton or Milton Keynes. Well, CBC, you have made Leighton Buzzard a 50,000 plus neighbourhood, but without a health centre fit for the 21st century. I'm sorry if this sounds ungrateful. I appreciate that there are budget constraints and amazing work being done by all the health professionals in our town. But CBC, you have a £10 million health infrastructure investment budget that you will only spend if the ICB say there is a need. But frankly, nobody's challenging the ICB about need. Why? Thank you.